Chapter 21, Informatics and Healthcare Technology. So on page 550, this topic of nursing informatics begins. This is a specialty that you can specialize in as well as an RN. So meaningful use of electronic health records. So these first three bullets, special attention to improve quality, safety, efficiency, and reduction or reducing health disparities, engage patients and families, improve care coordination and population and public health, and then also maintain privacy and security of patient health information. On page 550, it also talks about the results of meaningful use compliance for the EHR. So you have better clinical outcomes, improved population health outcomes, increased transparency and efficiency, empowered individuals, more robust research data on health systems. On page 552, A&A definition for health informatics or nursing informatics. The specialty that integrates nursing science with multiple information management and analytical sciences to identify, define, manage, and communicate data, information, knowledge, and wisdom in nursing practice. Also, on page 552, special attention to nursing informatics education by A&A. So A&A differentiates two types of nursing informatics: the information nurse, or IN, and the informatics specialist, or INS. The IN is a registered nurse with interest or experience in the informatics field. So read through this and just know the difference between the information nurse and the information specialist. So the INS, or Information Nurse Specialist, is often responsible for strategies developing, implementing, and maintaining and evaluating the clinical system, requiring collaboration with multiple disciplines. Components of the system development lifecycle begins on page 554 at the very bottom. It is a fundamental network for nurse informatics in any care setting. And so each of these bullets are explained in detail between 555 and 557. So the different components include analyze and plan, design and develop, test, train, implement, maintain, and evaluate. So the next two slides are questions to consider when choosing a system update or replacing a system with a new technology system. So I will not read through each of these questions. They are on page 555. The questions are continued on page 555. So on page 555, it talks about design and develop. So once you have analyzed and planned and chosen your new software, your new system, or updates to enhance your system, then the nurse should be involved in implementation of the system. Therefore, those who are using it can make sure that it is user friendly. So these particular questions are just to help make sure that during this phase there's no gaps, right? There's no gaps in education, and there's no gaps in what is required or what's needed for accurate documentation. 555 into 556, it talks about testing, and testing has several phases. And on table 21-2 on page 556, it lists each of these bullets. It explains when it should be performed or when this phase should happen, and gives you a description of that particular phase in reference to testing, as well as some examples and questions to consider when testing the system. So maintenance on page 556 to 557, they have several bullets which we'll go over the next two slides. And these are some of the tasks during the maintenance phase of the EHR implementation or update. So you want to make sure you have updates on the current orders, the medication list, the provider list, any scheduled procedures or appointments such as labs, monthly load. So any new medications, the pricing, any clinical alerts such as interactions with medications, any errors in the work queue. For example, it could be a transcriptional error that's causing a billing issue. Pricing updates. So drug prices may change according to the insurance provider or the pharmaceutical company that's supplying the drug. Quality measures updates. So this is triggered from the patient's chart, and it's basically stating a pattern in the facility, or maybe it is actually indicating that there is no pattern, and it's a good quality indicator report. Clinical decision support tools. So you have different assessments, and depending upon the results of those assessments, determine the interventions that you're putting into place, right? So there's policies and procedures to follow because of the assessments the nurses are doing, and monthly updates from the EHR vendor. So any updates that will help facilitate the information storage or maintenance, as well as sharing that documentation with insurance, as well as federal and state government offices for reimbursement. So evaluation begins on page 557. However, on page 558, there's table 21-3. It lists each of these evaluation steps, and it also gives you a description of each of them. I will not read through each of these evaluation steps. Please take the time to read them at your own leisure. Important informatic concepts include system usability, system optimization, standard technologies, interoperability, security and privacy, and blockchain. So this begins on page 557 and extends into page 561. They have a paragraph that explains each of these bullets. So on page 562 through 564, it talks about the merging areas in the fields of informatics. So there's a paragraph for each of these bullets. Patient portals, we talked about briefly earlier. Healthcare analytics, data visualization, predictive analytics, and big data. So we'll read through these when you have a chance. Telehealth and mobile technology. So this begins on page 564 and extends through page 565. So telehealth is the use of electronic information and telecommunication technology to support and promote long-distance clinical health care. Telemedicine is the use of telecommunication technology to support the delivery of all types of medical, diagnostic, and treatment-related services. Telecare refers to technology that allows consumers to stay safe and independent in their own homes. User patient portals begin on page 562, and depending upon the vendor, the patient portal can enable the patient to access medical records and other health information, complete various forms and questionnaires online, communicate securely with providers, request prescription refills, pay bills, review lab results. Patients can also use the portals to schedule appointments, receive reminders for appropriate screenings, enter clinical data such as their blood pressure, glucose levels, weight, review progress notes, access educational materials based on diagnosis or procedure. Of patient portal. So the benefits of patient portal are also on 562, and they have a little blurb that explains each of these benefits. So better health outcomes, chronic condition management, timely access to care, patient retention, patient-centered medical home recognition. Types of health analytics are on page 562. They have explanation for each of these bullets on that particular page. So the types of healthcare analytics include clinical, population, administrative, and financial. Genetics and genomics precision medicine begins on page 566 and extends into page 567. So the field of genomics has the potential to significantly change the way healthcare is delivered. Genomics plays a role in 9 out of 10 leading causes of death, including heart disease, stroke, diabetes, and Alzheimer's. Because genomic healthcare is heavily dependent upon data storage and interpretation, no other area is better suited than informatics to help support this evolving work.